Hello, it's Dr. Rhonda Johnson. Today is Sunday, November 6, 2022, and today I'm talking about long COVID, otherwise known as post-acute sequelae of COVID, PASC. Well, one thing we know about long COVID, it's affecting every age, every sex, and every race or social classification. Now, the common thread to long COVID is you had a COVID infection. Now, it doesn't matter if you've had a mild COVID infection or severe COVID infection. The CDC estimates that 40% of Americans have had COVID, and 1 in 5 Americans, or about 23 million people at this time, have long COVID. Now, women are more likely to currently have long COVID than men. Now, long COVID can affect just about every organ system, just like COVID does. And I'll be talking about that. So what causes long COVID? Experts aren't sure, but here's some of the current thinking: that the COVID virus or parts of its spike protein persists. This is called the viral reservoir hypothesis. Some researchers have done studies on long COVID patients, and they have found persistent circulation of the spike protein in the blood as long as 12 months post-COVID infection. Now, that's interesting because the half-life of spike protein in the body is very short. So its presence, continued presence, indicates there must be some type of active viral reservoir with replicating virus. Now, multiple studies have confirmed this, and some researchers say that it's not the spike protein that's causing the trouble, but that's just a marker of cells with ongoing infection. Now, some studies suggest that the home for the virus is in our gut, but again, that hasn't been confirmed. Now, another theory is that the persistence of the virus or virus particles cause inflammation, and our bodies trigger an immune response that gets directed. And this is ongoing inflammation that causes injury, scarring, and it can cause blood clots to form. So again, what causes long COVID is continued to be studied. There's not a firm answer yet. Now, in kids, long COVID can cause fatigue, attention and concentration difficulties, headaches, sleep issues. Long COVID could possibly be linked to the multi-inflammatory system complex, MISC, and could be linked to that rare hepatitis in the pediatric population. Now, long COVID in adults, and I'll go through the systems, in the brain can cause memory loss, difficulty concentrating, focusing, word retrieval challenges, headache, stroke, early onset of brain matter loss, and mood disorders. In the heart, long COVID can cause inflammation of the heart lining, a fast heartbeat, heart attacks, and heart failure. In the kidneys, long COVID can cause acute kidney injury and kidney failure. In the lungs, you can have chronic cough, shortness of breath. You can have lung scarring and fibrosis. In the skin, long COVID can manifest as bruising or unusual rashes or sensation. In the ears, nose, and throat, long COVID can cause ringing in the ears, decreased hearing, vertigo, loss of taste and smell. In the male reproductive system, you can have erectile dysfunction, swollen and painful testicles. In the blood vessels, there can be inflammation in the blood vessel lining, microclots, and abnormal function of the blood vessels. In the gastrointestinal system, you can have inflammation of the pancreas, leading to diabetes, chronic bloating, nausea, vomiting, change in stool habits, abdominal pain, and abnormal liver function tests. And in the immune system, you can have long-lasting dysregulation of the immune response. And folks, this does not represent every manifestation of long COVID. Now, treatment at this time, treatment is directed to the specific organ system that's impacted. Now, there was a preprint study released last week that showed Paxlovid reduces the risk of long COVID. However, in my opinion, we need more studies on this. So in closing, the best way to prevent long COVID is to not get COVID. The best COVID infection that you will have is the one that you never have. So folks, be careful out there. COVID is real. The pandemic is not over. There's lots of COVID around. Take care, folks. That's my message today.